Hello, I'm Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Today on InformerTV, I'm going to be speaking about some simple exercises called nerve slides that you could do to help with the condition named thoracic outlet syndrome. Thoracic outlet syndrome is a condition where there's impingement on the nerves somewhere up in either the neck, behind the collarbone, or right in here behind one of the chest muscles that causes symptoms down the arm. The most common symptom of thoracic outlet syndrome is numbness and tingling in the hands. It can be throughout the entire hand. It can also cause symptoms in the forearm. Other symptoms of thoracic outlet syndrome include sharp shooting shock-like pain, weakness in the limb, also discoloration of the limb where it's very pale. Fatigue also sets in. Most cases of thoracic outlet syndrome, like I said, though, the most common symptom of most cases of thoracic outlet syndrome are numbness and tingling down in the fingers. It can start very abruptly, or it can start very lightly and just gradually increase, an insidious onset, which is what happens in most cases. In thoracic outlet syndrome, there's impingement on a network of nerves called the brachial plexus. The nerves branch off the spinal cord in the lower part of the neck and the upper part of the mid-back, and they form what is called the brachial plexus. The brachial plexus is a network of nerves that sends communication back and forth from the spinal cord down to the hands. Now what happens is the brachial plexus can get impinged or get compressed in 3 different areas. That is what's known as thoracic outlet syndrome. It can get compressed right in here, between 2 muscles in the neck, underneath the collarbone, or underneath the pectoralis minor muscle. Now it doesn't matter which source of it occurs or what is the actual source of it. Doing nerve slide exercises is going to help to decrease some of that impingement and decrease the symptoms. Nerve slide exercises are highly effective in reducing the impingement on the nerves. How the nerves and muscles work is that the nerves run in between the muscles. When there's an impingement on the nerve, it presses down on that nerve, and when you make motions, the nerves and the muscles do not slide over each other like they would if there was no impingement or if everything was working the way that it should. So what the nerve slide exercises do is they move the muscles and they move the nerves so that it helps to reduce the impingement on those areas. When there's impingement on a nerve in one area, the muscles and the nerves do not slide over each other correctly. What that does is that causes scar tissue to form and press down on that nerve in different areas. So now there are usually multiple places of nerve compression. So the nerve slide exercises are going to help to move those muscles the way that they should and allow the sliding of the muscles and the nerves to be correct, help to break up some of that scar tissue so that the scar tissue is not encasing on that nerve and causing compression in different areas. Now nerve slide exercises are non-exertion, non-resistant, simple exercises. You can do them throughout the day. You can do them while you take breaks from working at the computer. Say you're working at the computer for 30-40 minutes. You stand up, you get in good posture, and you do a few repetitions of the exercise. What I always like to tell people is concentrate on the form, do it correctly. The form should be precise, precision-like. Learn how to do it correctly, and then work up to 10 repetitions each time that you do it. When you're doing them, if you feel any pain or symptoms, skip that one and then move on to another one. If for some reason when you get to a certain point in the exercise and it causes pain or symptoms, then obviously you want to eliminate that part of the exercise and just work through a pain-free range of motion. Any type of exercises, but especially nerve slide exercises, should not elicit any pain or symptoms. Nerve slides can be used as preventative care, which I highly recommend. Preventative care is cheaper and less expensive and easier to deal with than dealing with an injury. Nerve slides can also be used when you start to feel those symptoms. That is a great time to eliminate that impingement. If you start to feel something, go ahead and Go to a medical professional, make sure it's not a serious pathology, but you could also start up doing a nerve slide exercises. In chronic or what's known, or the long-standing cases, go ahead, do the exercises. It'll help to eliminate the symptoms, and it'll also help to eliminate the source of those symptoms, which is the most important thing. The first nerve slide exercise for thoracic outlet syndrome is very simple. You want to start with just a small number of repetitions, and you could build up to 10. Again, they're non-exertion, non-resistance exercises, and you want to work through a pain-free range of motion. The objective is to break up nerve impingement. The first one, you want to stand up nice and straight, in good posture, tilt your head to the side you're going to be working. Now I'm going to start on the right hand side. You're going to take the right arm, you're going to bend at the elbow, you're going to flex the wrist, and you're going to tuck it just like this. Now this is your starting position. You're not going to be in this position for very long. I'm in this position for a long time because I'm explaining things. You want to keep your head tilted to the side, straighten out your wrist and your fingers, bring your arm down, and bring it out to the side so that it's at a parallel to the floor. It's 90 degrees to your body. You want to bring it back as far as you can. Now that is very important because it's going to help to stretch out these muscles up and through here where the impingement can be if the pectoralis minor is the source. From that position, you open up the hand, splay your fingers, bend your wrist upwards, and tilt your head to the opposite side. And then you do everything in reverse. Come back to the starting position. Again. When you do that, obviously you want to work both sides, even though you may only have symptoms on one side. You want to start nice and slow, but use perfect technique. Your technique needs to be flawless. Look at how I did this on the video, practice it over and over again, and it will definitely help. When I do it, I always feel a surge of energy from my neck going down into my arm and coming back. Everything feels nice and loose after I completed it. That was the first one. Now I'm going to explain the second one. Now the second nerve slide exercise is almost the same thing. There's just some slight variations, so I'm going to go over those. When I'm doing this one, I'm going to use my left arm, just because on the other one I use my right arm. Now on this one again, you want to stand up straight, in good posture. You don't want to be slouched forward. You don't want your neck being forward. Try to stand up as straight as you can. You want to start with your arm bent. Again, we're going to be working the left-hand side. Flex your wrist upwards, bend your head, straighten your head, bring your arm down, raise your arm up to parallel, bring it back, and then twist your hand so that the palm is facing upwards. Bring your arm back as far as you can. Really stretch this out up in here. Bend your wrist downwards and tilt your head towards your wrist. Bend your wrist upwards and tilt your head away. Tilt your wrist downwards and tilt your head towards your wrist. And then do the opposite. And then come back to the starting position and perform another repetition. This has been Dr. Donald Ozello of Championship Chiropractic on InformerTV, explaining and demonstrating the effectiveness of nerve slide exercises for thoracic outlet syndrome. Thank you very much for watching. Again, Donald Ozello of Championship Chiropractic.